Hi, I'm Shamika Boone, and I'm a program project manager as before. And our project is building a network of birth workers with communities in mind. Next slide.
I'm Martine Ferris, as Gianni has said, and we just wanted to show a little bit about our team here at TBEI. And we're really excited to show how much we've grown in the last year. We've actually doubled the amount of employees we have in the last year, which relates a lot to our sustainability as we have all this rapid growth. Next slide, please. So you already shared a little bit about our organization, but our mission here is to equip families in Tulsa to have healthy births with dignity and to reduce maternal health disparities. We are working with a lot of different community organizations to achieve this. And one of the ways that we do this, besides our Safer Childbirth Cities projects, is we do hospital quality improvement, community outreach, working on a preconception program, and our Safe Space for Black Women, which is Queens Village, Tulsa. Next slide, please. So our Safer Childbirth Cities project is really focused around the doula work, both doula services and training. Our doula services, we have 7 staff doulas and 2 part-time doulas, and they serve Black, Native, teen, and justice-involved or navigating substance recovery individuals. They're able to provide doula support prenatally and up to a year postpartum, including some early parenting support. Our doulas have served 253 families since 2019. And the second part of our Safer Childbirth Cities project is the doula training. So we have a 20-session training program. It's 60 contact hours, and we include training on communication, attitudes, beliefs, and values, providing culturally congruent care, and also the emotional and physical labor support techniques. Like Gianni said, our doulas are non-medical professionals. They provide lots of emotional, physical, and educational support. We have trained over 100 doulas to date, and we have 18 who are going to graduate in December as newly trained doulas, which is very exciting. After they finish training, we also have a certification step where they have to attend or observe 3 births and also conduct prenatal and postpartum visits with 3 different clients. And the certification process is important as we're talking about workforce development and sustaining this network of birth workers in Oklahoma. Next slide, please. So as we thought about this grant and working on, as Shamika and I were working on this PowerPoint, thinking about our definition of sustainability. Like I said, we've trained over 100 doulas to date since 2019. So in a pretty short period of time. When we think about sustainability, we really want to look at creating that network of birth workers in Tulsa and across the state and making sure that everything, that they're all able to continue to practice so that the maternal health outcomes do improve across Tulsa and the state. Next slide, please. Some challenges that we have to this, especially with our rapid growth here, is maintaining connection with our trained doulas. We have had some trouble making sure they all continue to practice and that we're able to support them in the best way. And we also have had trouble with getting fully trained doulas to have access to quality and affordable extended learning, which of course is really important to make sure that we have the best trained doulas that we can. Next slide, please. So when we're thinking about these 7 domains of sustainability that AMCHIP provided, we're looking at how TBEI is addressing each domain in relationship to the challenges that we're seeing. One of the ways for the first domain, continuous quality improvement and education, we are working on a workforce development project that includes this continuing education. And Shamika will talk about how this grant project addresses these sustainability domains. But for us, trying to make sure that doulas have access to the best continuing education that we can provide to them. The next domain, which is benefits to the community and to users. One of the ways that we do this is fostering those connections within the doula community and supporting them in their Medicaid reimbursement, supporting making sure that the community in general has access to quality doula care and that the doulas have access to getting paid. And the next one is stable funding. So we are really lucky here at TBEI to have stable foundation funding, and that allows us to seek some smaller funding through grants to help us pilot different programs like our summit and our CEC program, which is the stuff that Shamika will talk about in a minute. Our organizational characteristics, like I said, we serve Black, Native, teens, and those who are justice involved or navigating substance abuse. So sustainability for us in this area looks like supporting doulas who can serve more communities, not just the ones that we serve, but all the different communities across the state and in the Tulsa area specifically right now. And our program adaptability, well, like Gianna said, we got started right in 2019, right before COVID. And so one of the main things that we had to adapt was providing doula services and doula training virtually right at the very beginning of all of this. So TBEI has a great track record of being adaptable and pivoting. It's our favorite word from COVID. But so some of the adaptations that we're working on right now are adding recertification as part of that workforce development piece. And also just looking at how our training is expanding as we're working with a local tech college to get those trainings out there. The next one is contextual and environmental fit. So in this current environment, we see a lot of public knowledge about maternal health disparities and a lot of people being really interested in what is a doula. And currently in Oklahoma and many other states, the Medicaid is starting to reimburse doulas. So it's really becoming quite an environmental issue about maternal health, which is really great. So for us, the sustainability looks like maintaining contact with all of those doulas so that we can really support them as people seek out their services. And the last one is active partnerships. We are really fortunate to have a partnership with Tulsa Technology Center, which is a local tech college, and they provide a space for training and also for the summit, which was our main focus of our grant project. We also have a lot of collaboration with different subject matter experts in the community that we use to help with continuing education. And now Shamika is going to share a little bit about our sustainability grant project and how it addressed some of these domains in relationship to our sustainability challenges.
Okay, so we had our community-based doula summit. It was our very first summit, so we're pretty proud of this project. And then we launched our learning management center called Touchable, and then our social platform called Circle. And so with our community-based doula summit, that particular event was a 2-day event. We invited 92 of our community-based doulas to attend. We had about 67% of those individuals to pre-register to the event and 40% of those individuals to actually attend. During this event, we had 4 local experts to come and speak about their particular subject, which were breastfeeding, nutrition, mental health, and how to start up a business. And so with those workshops, they were professionally recorded so that each of those doulas could either attend that particular workshop during the event or later go to our learning management center, Teachable, to actually go over that particular subject. And so we're pretty proud of the opportunity for anyone that was unable to attend or anybody that was only able to attend just 2 of those workshops. And with our social platform called Circle, with that particular event, that is our form of Facebook or Instagram, where each of those community doulas can go on there and receive resources, also be able to connect with each other, receive any upcoming events, be able to communicate with anyone or us if they needed to be able to connect with us as well. So with these particular these particular platforms, they're able to connect with each other, connect with us, and be able to receive any type of extra continuing education credits if they needed to. Next slide, please. And so with our project, we realized that we had a few challenges. And so as Martine mentioned before, we wanted to support environmental change by creating a community building environment for them. Just creating those education units, creating a space for them to be able to connect with one another. Doulas need someone to be able to serve as a backup doula for them, and may not have any other doulas around them, or may not be able to connect with someone from their regular cohort, and they can connect from a different cohort, so they can be able to connect with one another from that platform. So we initiated a survey. We collected a survey overall. And so with that survey, we realized we wanted to see what they needed, they wanted, and really it helps us with additional funding for later on. And so some of those, we had about 82% of those particular individuals that realized they wanted to connect with one another. And so getting those doulas connected with one another was majorly important. So we thought that if we were able to create a space for those individuals, they were able to do that. So, and then during the summit, we realized that we had too many breaks and so we wanted to tighten up on the schedule for the event. We had about 83% of those particular doulas to mention that they would have liked for some of the workshops to be longer, or to have more of the workshops available during the day. So we had a lot of breaks for them to kind of socialize with each other, or connect with some of the resources tabling there at the event. However, they would have preferred to have more workshops for the event to have less breaks. And then that second day of our Community Doula Summit was an outside event where each of those doulas could come and gain to fellowship, eat, barbecue. We had inflatables, we had games, outside games, connected with one another. We had masseuse for the adults that may not feel like the inflatables were fun to them, but had something to relax. And at this event, it was a little cooler outside than we would have hoped. So with what we did was we pivoted, like Martine mentioned, and we were able to purchase coffee, hot cocoa, warm tea, and we were able to put that information on Circle, and all of those doulas began to bring their families out, bundled up a little more, but that's what they did. They bundled up and came and had cocoa, coffee with us, and enjoyed time together and ate together. Next slide, please. So what we hope that would be different is developing a workforce of birth workers here in Tulsa area, and in the future, hopefully in the Oklahoma area. Ensuring more doulas are certified, continuing to get certified, offering continuing education credits to help them get paid through Medicaid reimbursements, supporting community-based doulas in developing relationships and creating community with each other, hoping all fully trained doulas are gaining that level of confidence to go back to their community with the skills they are learning and have learned from the Community Doula Summit. Next slide. So measuring our success, we had about 40% to attend our summit, and then 57% filled out the survey. And then 100 of that, the percentage of those who completed the survey said that they felt that the summit was a valuable experience and can't wait till the next year. 86% of those trained doulas join circle. And so that is a level of communication where they are loving it and fully engaged. Our next slide. Our conclusion is external factors. As Martine mentioned before, we are a part of a larger entity or larger organization. So that grants us the blessing of being able to write sustainability into our future budgets, but we realize that we are growing at a rapid rate. As Martine mentioned earlier, that this time last year, we were half the size that we are now. And we know that by the second summit, we'll have over 150 doulas to invite to the summit. And so 3-5 years down the road, we know that we'll need to begin to apply for more grants and apply for more resources and things like that to sustain this, because it'll grow, pretty rapidly. And what will accelerate our success? We are pretty, grateful and wanted to express the level of gratitude for the huge contributor to this grant, allowing us to pilot and jumpstart our project and prove its importance for the future doulas that we are, training, for the future doulas that we haven't even met yet. And so we are just grateful and want to open it up for questions at this time.
Thank you so much for that presentation. We have some questions in the chat that I think we can definitely address and discuss. I think the first one that came in was, why do you think that there was only one collaboration project? And I think that's for AMCHIP. I think that the collaborations between cities, it takes a little longer to develop that trust between cities, but also to develop a work plan that really makes sense, right? And we really put in our application that we wanted people to think about not only what roles and responsibilities looked like, but also the sharing of intellectual property, and be very intentional about it. So the one collaboration project we have is actually also between Tulsa, this team here, and the San Francisco team of SisterWeb. They are working on training. So SisterWeb is training Tulsa on how to do data collection and evaluations for their community-based doula program, using a specific software. And then they're trying to work together to see if outcomes are showing the same progress. So we're really excited about that, and you will hear more about that project during the second set of sustainability webinars that we'll have early next year. I guess passing off this question to the Tulsa team here, somebody said that they are interested in the support for doulas in terms of Medicaid reimbursement, and then asking if that's a workshop designed by consultants, or is it support through staff at AMCHIP? Are those trainings designed for doula organizations or individual doula providers? Do those reimbursements have to be affiliated with a healthcare system? So a lot of questions there. To break it down, I think so the training that has mentioned by Martine is not related to AMCHIP. It's all very much Tulsa Birth Equity Initiative's work and proprietary efforts. So I think, Martine, if you wanted to talk a little bit more about that and then discuss how it was designed and who it's designed for, I think that would be amazing.
Sure. Yeah, so when I talk about Medicaid reimbursement, I'm speaking specifically about the state of Oklahoma, which recently decided to open up Medicaid reimbursement for doulas. And so they're allowing doulas to bill under Sooner Care, which is our version of Medicaid, and then get reimbursed for births that they do. So because that's new and opening up, we have been working on how we can support our trained doulas. Here at TBEI, our staff doulas are able to access a level of support and help with that reimbursement. But our trained doulas, like I said, we have over 100. They're not able to access that. And so what we're doing is we're developing these short webinars. Actually, our first one is next week, where we are walking everyone through how to get their registration numbers and how to submit their claims, ways that they can do data collection, everything to make it easier for them. I hope that answers the question. At least in Oklahoma, you have to be, so the reimbursement is through the Oklahoma Healthcare Authority, and then we are one of the approved providers for approved certifying boards for doulas. So they have to go through a specific certification process. There's, I think, 15, and TBEI is one of them.
Thank you for that information. Can you talk a little bit about the Medicaid doula reimbursement in the state? When did it start? Has there been uptake of it? I think everybody would be interested, because I think as many of the attendees who are here today may or may not know, states have individually been taking this on, and it varies very widely from state to state what this is looking like.
Yeah, so what we know is very little compared to what we don't know. Technically, I think it started in July. As far as we know, we are still personally figuring out how to actually do the reimbursements ourselves. It is very much a building the plane as we fly it sort of thing to try and get this off the ground for our trained doulas as well.
I feel like I just have more questions about that. Is that because the like the reimbursement system is difficult to navigate, or is there other issues there?
Shamika, I don't know if you have anything to weigh in on this. I am not the expert here in the office on this at all.
I am not either. What I would say is I think it, it's that learning curve when something new is coming. I think everyone is just trying to navigate through. I think that's really what it is.
Yeah, thanks for sharing that. And I think the one thing that I will say that is interesting about what's going on in Oklahoma is that they have centers like yours that are, the ones providing this kind of support and training. And I think that across different states, you'll see different models, and not all of them are providing, specific centers to go to for training on this. So another question that we got in the questions is in regards to sustainability, what is the typical caseload for a doula? And I think, again, this varies widely, but if you want to speak to Tulsa Birth Equity Initiative's doula program, that would be amazing.
Well, I would say our doulas are 2 delivery dates per month, so that they can ensure that they are available to their client when that time comes for them to go into labor. And then they also have a backup doula to support them should whatever unforeseen reason that they would not be able to attend.
And I think that's part of the beauty of these community-based doula organizations is that, clients can hire a doula privately and just have one doula, but that doula might not have a backup person. So if they're out sick, or, many doulas have children of their own, if they have something that they need to take care of their child and the client goes into labor, there's no backup for them. So, working with an organization or receiving your doula services from an organization is really helpful, because they have all these support systems in place, and as well as when a doula doesn't know the answer, they have other doulas to rely on as well.
That's kind of why we said that the doulas that do not work for Tulsa Birth Equity Initiative, they need to be able to connect with each other, so that if they do need a backup doula, they can reach out to their backup, their community doula community, and ask for them.
Yeah, and that's what we found so unique about the summit that was proposed and was held. in Tulsa is that, it's really not about being competitive or like, oh, we're the only doula organization in town and you need to be part of us or not. It really was like just bringing together everybody who's working in this space towards better outcomes, making sure that people can align, and making sure that people can utilize the synergy to collaborate. So yeah, I think that that's, what we found most interesting about this project. I don't have any other questions from the audience, but if there are any other questions from the audience, feel free to pop them in the chat.